Fort Riley. My name is Lieutenant Alexandra Skazafava. I am the Chief of Physical Therapy at Irwin Army Community Hospital. With me today, I have Specialist Mendoza. She is in her 38th week of pregnancy. And today what we're going to talk about is exercise during pregnancy. Exercise is incredibly important when done effectively and well and safely in order to have a healthy and successful pregnancy, delivery, and then also help active duty moms especially return back to their prior level of function and get them back to full duty. I kind of want to start this by asking, what was your experience with exercise during pregnancy?
So about the second trimester, when I started getting uncomfortable with running, I reduced it to walking. Also for more cardio, I would hop on the bike for a little bit. Mm-hmm. I personally tried to avoid ab workouts.
Okay.
I mostly stuck with cardio.
Yeah, okay, awesome. And I think that that's a pretty common theme, right? So people will find that with high impact later in their pregnancy, they're a little bit more uncomfortable, and I think that what you did was appropriate. The biggest thing is I think there's this common misconception that when you're pregnant, you shouldn't work out as much. And that's not necessarily the case. I think it's an important time to tailor what you're doing to how your body's responding to your pregnancy and the changes that are occurring in your body. If you're a runner or you're a CrossFitter and you have been for years prior to your pregnancy, there's no reason that you still can't do those movements. I work with women who run up until the day they deliver. Same thing with, functional heavy lifting. The key there is that decreasing weight significantly is a really important part of that change and that exercise shift. I also love the piece that you said about, decreasing ab workout. And it's not that we need to necessarily decrease it, but one thing that can occur during pregnancy that is very common actually is that we have what's called a diastasis recti, where the two muscles that run along the front of your stomach start to separate a little. I know it sounds really scary, but again, it's very, very common, and typically it's completely painless. And that's one of the reasons that we want to stay away from heavy core works like sit-ups, V-ups, leg tucks for those of you who are training for the ACFT, because that places a lot of stress through that linea alba, or through that connection between those two muscles. And then also we ask that prior to getting back into ab work, you talk to your midwife or your physician to make sure that you're cleared to do that activity. And also it's really important that after delivery, and Specialist Mendoza's had 2 babies before this, that you give yourself time to recover. You can walk as soon as you're comfortable, but getting back into that activity and that high impact is something that needs to be gradually worked up to. I think that there's this thing that I see with women, and they think, hey, you know what, I need to be back to where I was right after delivery. And you have to remember, you just gave birth to a baby, and you need to let yourself some time to recover as well. One way to think about exercise when pregnant is to think of it like we're training for a marathon, not for a sprint. So if we were going to go run a marathon, we're not going to go run it cold turkey. Think about delivery that same way. 9 months is a long period of time not to exercise. If we can maintain our level of cardiovascular activity and fitness and strength, that sets us up for better success during delivery, and then also in recovery and return to your prior level of function, your prior fitness level following delivery. It's really important to keep in mind that if you're having things like increased vaginal bleeding or any vaginal bleeding at all, increased cramping, sharp pain with exercise, or if things don't feel right when exercising, you need to back off on the intensity or the weight or the amount of impact in your activity, and then also make sure that you address that with your midwife or your physician at your next visit. Now we're going to talk about some exercises that you can do to build glute strength and leg strength during pregnancy. These are completely safe to do through all phases of pregnancy, and there are also modifications to make them a little bit easier or a little bit harder as you progress through your pregnancy. It's completely up to your tolerance and what you can handle. So the first one is the clamshell. For this, you're going to lie on your side. Your feet, your hips, and your back are all going to be in a line. From here, keeping your hips stacked, you're going to bring your top knee up a couple inches. Good, and come on down for me. And just keep knocking out those while we talk about them. So these are really great for building that hip stability here. If you're active duty, you've probably done the hip stability drill before, and this is very similar. It's a very small movement, and we're really thinking about the stability of the body and the spine during this movement. How's that feel? Feel that working through here? Awesome. And doing about 2 sets of 20 is a great way to really feel that glute working. Now we're going to go into the bird dogs, so if you would mind hopping into that position. So this exercise also works on core stability, glute strength, but then also sequencing of our upper body and our lower body at the same time. So for this, we want to make sure that your back's nice and flat. I'm going to have you look down at your hands so that your neck's nice and flat as well. Because she is in her 3rd trimester, this is going to be a little bit challenging to do, but I have faith in her. I want you to take your belly button and try to draw it in towards your spine so you're contracting those muscles. This is a completely safe way to strengthen those core muscles during the 3rd trimester of pregnancy. From here, she's going to stabilize herself and bring up one arm and the opposite leg. Good job. Nice, slow, and controlled. And come back down. Beautiful. And you really want to focus on keeping your pelvis or your hips nice and steady and not letting them twist throughout that motion. Let's try one on the other side. Good. And come on down. Beautiful.